Welcome to Wentworth Douglas Hospital Laboratory. I'm Darlene Bickford, the Support Services Manager for the laboratory. I oversee the phlebotomy and pathology team. The lab is one of the most important places in the hospital that no one really gets to see. We have tons of technology that lets us perform hundreds of diagnostic tests every day. It really takes the people on our team to make the technology work for us. 80% of decisions that are made by our doctors and clinical staff are strongly dependent on the results that come from labs like ours. We are looking for people who work well within a team and have strong customer service skills and a strong focus on patient care. If you have an interest in patient care and science, the laboratory may be the perfect place for you. At Wentworth Douglas Hospital, we employ some of the best phlebotomists in the Seacoast. Our team is made up of efficient, reliable, compassionate, and skilled phlebotomists. The phlebotomy team has a significant role within the hospital, working side by side with many other healthcare providers. In addition to working in the hospital, we have 4 outside locations to provide phlebotomy services for anyone who may need lab work outside of the hospital. Katie is one of our phlebotomists. She works both inpatient and outpatient. She will now show us a typical day for one of our in-house phlebotomists.
I have been here in April. It would be my 13th year. I've been working for Wentworth Douglas Hospital. I love going everywhere. We don't just stay in one spot all the time. We're running around the floors with patients, making sure their results get in right away. And I just love seeing people, like even the nurses and the staff. This is my workstation on wheels. And this goes with us everywhere we go. Well, in the morning when we come in, we have roughly about 100 to 110 morning draws we have to do. And that's split up between about 5 or 6 phlebotomists. We go all over the hospital. We go to the emergency room, we go to same-day surgery, we go to the cancer center, our Seacoast Cancer Center. If there's a trauma in the emergency room, we also have to attend to that. It's a very busy place. This was 3G. We have a lot of people who are afraid of getting blood work done, whether they had a bad experience prior or as a child. And we do draw a lot of children as well who have had, they might have a bad experience with shots. And that's one of the reasons why I like this job. I do get that interaction with patients. I get to see the patients, be with them, and that makes me happy knowing that I might make someone's day by either being able to get their blood work drawn right away if they're a difficult stick or not, and then knowing that we have to bring it right down to the lab to get tested right away, that the results pretty much start with us. So if we have a couple patients up here, we'll draw them. And if we get a couple patients, we'll go right to our pneumatic tube system where the blood gets shipped right down to the main lab and gets processed right away on the analyzers. And every department in the hospital has one. The emergency room, the cancer center, all the floors, they rely on that to make sure the blood gets down to the main lab to get resulted right away.